Welcome to the Dental Capsule. In this series, we'll cover different dental topics and real clinical situations in short, easy-to-follow capsules, designed to help us improve how we manage our daily cases.
Have you ever asked yourself, when should you separate roots during extraction, and when shouldn't you? Let's simplify it and build a clear roadmap for root separation. When we think about tooth extraction, the first thing that comes to mind is forceps extraction. But is it the only one? Of course not. Sometimes we need elevators, either because the tooth doesn't have enough grip or because we want to luxate it before using forceps. Now, for an elevator to work effectively, three conditions must be present. First, there must be a point of application, a space where the elevator can engage between the root and the bone. Second, there should be no contact with adjacent teeth so the tooth can move into an empty space, as proximal contacts limit tooth movement and reduce the effectiveness of luxation. And third, the tooth should be single-rooted or have fused roots. A retained root of a single-rooted tooth is a perfect example where these conditions apply. But what if there's no solid point of application, like in cases of deep caries or a cervical fracture? In that case, we move towards surgical extraction with bone removal. Now here's the key point and the focus of today's capsule. When we deal with multi-rooted teeth, especially molars with widely separated roots, elevator forces don't work equally. The force favors one root and works against the others. So one root moves and the other stays locked in place. In maxillary molars, this becomes even more complicated because we're dealing with three roots, although the maxillary bone is more flexible. So what's the solution? Root separation must be done. We separate the roots so that each root has its own independent path of delivery. So when do we decide to separate roots? We consider root separation when we have a molar with widely diverging roots that cannot be extracted using forceps or elevators alone. This usually happens because of one or more of the following: poor grip, high resistance, like thick bone or wide root divergence, or a fragile tooth, such as crowned or endodontically treated teeth. Now let's talk about how we actually do it. In mandibular molars, we make a buccolingual cut right through the center of the tooth. This divides the tooth into mesial and distal halves, corresponding to the mesial and distal roots. In maxillary molars, we start by separating the buccal roots from the palatal root. Then we separate the two buccal roots from each other. This creates a T-shaped separation pattern. You can start by outlining the cuts in the tooth structure, then deepen them through the root trunk and into the inner radicular bone. You'll notice something important here. Bone offers less resistance than tooth structure, which helps you to make sure that you have gone through the full depth of the tooth. Keep deepening the cut until the fissure burr reaches full depth into bone, and the trough should be wide enough for the burr to feel loose inside it. So, what's next? Now we apply the elevator, usually a straight apexo elevator. We start from the mesiobuccal and distobuccal line angles, pushing the roots toward the space we created. Once the roots are luxated, they can be delivered in two ways, either using the lever principle with elevators or by using root forceps if they're loose enough. In maxillary molars, we always remove the buccal roots first, and finally the palatal root is grasped with a remaining root forceps and removed using rotation only. Before we finish, here are some important clinical tips. First, root separation without a preoperative X-ray may be acceptable only in first molars, upper and lower sixes, but for second and third molars, a preoperative radiograph is mandatory to assess root anatomy and divergence. But academically, you should always take a preoperative X-ray before going on with the separation process. Second, In upper second and third molars, if the two buccal roots are very close or fused, you may only separate them from the palatal root and remove them together. Third, in mandibular molars, if one root fractures deeply, start by removing the easier root first. Then use a Winter's crossbar and elevator to remove the remaining root, with interradicular bone removal if needed. Fourth, always be cautious about the buccal and lingual soft tissues and bone when using a surgical burr. If you're not sure the separation is complete, rotate an elevator inside the trough to fracture any remaining tooth structure. Fifth, and this is critical, after separation, apply the elevator as apically as possible. Shallow forces tend to fracture the cervical portion and make extraction much harder. And finally, during separation, go as deep as possible to remove the interradicular bone and create space for luxation, unless bone preservation is required in implant plan sites. Injury to the inferior alveolar nerve or the maxillary sinus is extremely unlikely. So remember this: root separation is not a complication. It's a controlled strategy that makes extraction safer, easier, and far more predictable.
Thanks for watching. If you found this helpful, don't forget to like and subscribe. Share your thoughts or questions in the comments. We'd love to discuss them with you. See you in the next capsule.